Hello and welcome to another lecture from Ophthalmology. Today we are going to discuss about cataract. Now, cataract is a condition in which there is cloudiness or clouding of the lens. Okay, or in simple words, we can say that opacity of eyes is known as cataract. This is how clouding or cloudiness of the eyes looks like, and this is actually cataract. Okay, this is how it looks like. The most common cause is old age. The old age means that people who are in their fifth or sixth decade of their life and who are really old. So you may see this condition in those kind of patients, and you can also see cataract in patients who have some endocrine conditions, some underlying conditions like diabetes, okay, and a number of other diseases like many autoimmune diseases, many diseases like like dermatitis and like SLE and like things like cataract can also be congenital cataract. Now, what is congenital cataract? Congenital cataract is the cataract in neonates or the newborn babies, and this cataract they have contracted from the mother, and it is common in with those mothers who are previously affected with one of the torch diseases, okay, and some radiations, some chemical radiations, and some drugs, some ophthalmological drugs, topical drugs like corticosteroids can also affect the lens of the eyes and can cause its opacity. Okay, so these are all the causes, and these causes are very much self-explanatory. Okay, the thing which I have to explain is the pathophysiology of the disease. Okay, let me draw you a good diagram. How does this disease occurs? So this is something that is very transparent in color. What we need to understand is that this lens is composed of two kinds of cells. Okay, it composed of epithelial. It itself is composed of epithelial cells. This lens cover is also made up of modified epithelial cells. Now you can understand that whenever I disturb or injure this epithelial cells, these epithelial cells will be disturbed, and their natural transparency will be disturbed, which will affect ultimately my vision. So this is the actual pathophysiology of cataract. This is the injury or the trauma to this epithelial cells, due to which it's forming an opacity and blocking the vision. Okay, so this is what we need to understand about the pathophysiology of cataract. Okay, this will be the opacity. Okay. Okay, after the pathophysiology, what we will study about is the types of cataract. Okay, this types of cataract is also related to this topic, so let me explain it right over here. Okay, let's go back. Just imagine this is a lens. Okay, and as you know, the lens has two portions. The one is the central portion, which is known as the nuclear portion, and the one is cortical portion, which is the cortex. Okay, this is known as the cortex or the cortical portion. If this cortex is affected, which is made up of modified epithelial cell or tissues, when this cortex is affected and the cortex opacity is just it is restricted to only this portion, we can say that this cataract is of this one, cortical cataract. Okay, this is an example of cortical cataract. And if the central portion of the nucleus is affected, like the portion which is here, if this nucleus part of the eye is affected, we will say that this will be which one? This will be the nuclear or the nuclear cataract. Okay, this will be the central or the nuclear cataract. Okay, and okay, and if the posterior part of the cataract is affected, if this posterior cortical portion is affected, what we will say is that that will be posterior subcapsular cataract. Okay, this will be if the posterior part. Okay, let me write it over here. This will be the posterior part, and this will be the anterior part. So if the posterior part of the lens is affected, we will call it as posterior subcapsular cataract. Okay, so these are all the three types. Okay, now come back to the clinical features. Now imagine some patient having the complaint in your and he arrives in your office. What type of what complaints will the patient have if he have the cataract? He will have clouding of the pupil. Now this is very much important and very much differential point in diagnosing. You have to examine the patient, and if you find clouding of the pupil, just like here in this picture, you can see that the not the whole cornea is affected, but only the central pupil part is affected. It means that this is what this is a kind of cataract. So clouding of the pupil will be there in the patient eyes. The patient will complain of altered vision. He will say that he is unable to see things very clear. The patient will complain of halos. Now halos is, imagine you driving a car in the night, and you can see that the red lights which are being blurred in front of your eyes, so that will be halos. Okay, so this is halos. You can search it on the Google. You can find very easy and explanatory pictures. Now the patient, after that, the patient will or can complain about his vision loss. Distance vision loss will be more than the near vision loss. He will have more distant vision loss. Okay, so this is one thing. And he can also complain about color differentiation problem. Obviously, when there is clouding in front of your eyes, you cannot see things very clear with this kind of eyes, so it can be different for you to differentiate between red color and blue color and yellow color and orange color and things like that. Okay, so color differentiation problem will be there. These will be the clinical features in the patient. And as we have already discussed about the types, so let's go and jump into the diagnosis. How will you diagnose a cataract? Cataract can be very easily diagnosed by doing clinical examination or by doing slit lamp examination. And you can do the ophthalmoscopy. Okay, ophthalmoscopy is when you see the eyes, inside of the eyes, with the help of an ophthalmoscope. Okay, so ophthalmoscope is an instrument and used to look into the eyes. Now okay, compiling this story, you have a patient and he complained of these clinical features. You diagnose him, and you diagnose him with slit lamp examination. You diagnose him with ophthalmoscope, and then you have to treat the patient. Okay, so how do you treat a patient of cataract? There is no medical treatment for the cataract. You cannot treat a patient of cataract with medicine. Okay, you can only advise him to go to the surgery. The cataract surgery is a surgery that is only advised in this part of the disease. And in modern times, there are laser therapy which by which we can shed the cells of the cortex, and like you can shed the cells of this part, and you can easily cure the opacity or the damaged tissues and repair them. Okay, so these things can help. Okay, so this was today's topic. I hope you understood. There was nothing much complicated, and see you in the next topic. Thank you very much.